Hello and welcome to Breaking the Cycle. My name is Alan Hyde, and today we are joined by a special guest, April Morris, nurse practitioner with her business here in the Dallas-Fort Worth area, Momentum Health and Wellness. We're going to get into some interesting discussions today of just some of maybe we would say like cutting edge, or just maybe not the ways that a traditional doctor would treat certain issues, both in the realms of addictions, but also traumas, mental health, and just general health and well-being.
Definitely.
April and I have been coordinating this for some time, so we're excited to sit down and chat, but
Yeah.
thank you for being here.
Thank you. Thanks for having me.
So nurse practitioner, what got you into this
Yes.
realm? Why the medical field?
Oh, goodness. Well, let's see. I went to nursing school, and probably before that, actually, I thought I was going to be a veterinarian. And then I decided to go to nursing school and put myself through school. That was a little bit of a struggle as a young adult. And when I finished nursing school, I thought, well, I'm never going back to school. This is it. I'm just going to go in the working world. And, when it's all gun-ho about being in the ER. ER medicine was my thing for a while. And then I realized that that's a challenging environment, especially if you want to have a family and kids. So I actually morphed into the world of hospice, which is unusual, but I fell in love with it. It was so rewarding. And through that role in hospice, I realized that I really liked having a direct impact on my patient's care. Meaning, I don't want to just follow the order of a physician that they give that maybe doesn't make sense to me with my patient. I like to be able to have a direct hand in the direction of their care. And so that pushed me to go back to school, which I said I would not do, and went back to grad school and pursued being a family nurse practitioner. So I've loved it. I mean, it was the best decision I ever made, worth all the pain and suffering.
Sure.
And as I went out into the work world as an NP, I realized that, our system's broken. Obviously, our healthcare system is very broken, and I can't change it all, but I want to be able to impact my patients', experience with healthcare. And so through working at different practices, I just realized just how broken it was and wanted to figure out how can I make a difference in this for my patients. So I started my practice 6 years ago. It's a direct primary care practice. So what that model means is that I don't bill insurance for my care. So what that means for my patient is it actually saves them money, even if they have insurance. They don't have to pay a copay or deductible. Their care is comprehensive. They pay a monthly membership, and that covers all of their care with me. Includes an annual physical, the labs that go along with that. And then if we need to do diagnostics, imaging, things like that, then we can bill insurance, and insurance will cover prescriptions and things like that. I also have patients that don't have insurance, so healthcare is very expensive for them. And so this is a way that they can definitely save money. But I love it mostly because I get to treat my patients the way that I want to and the way that they need. So I can do what works for them, and not have to follow all the little rules of insurance. So I know how to work with insurance when I need to, but I also know how to circumvent it to get what my patient needs.
Yeah.
And that's very important to me.
When we all sat down, it was you and me and one of my clinicians, and we chatted afterwards. She had made the joke. She said, "This is like it's rich people stuff for the everyday man," which is
Yes,
nice.
yes.
We really appreciated your breakdown of just the concierge type services, where you pay a fee and you get the services, and the fee is manageable.
Yes.
And that was just really nice. Like I had never even thought of that as a concept for like my own medical care
Right,
as a
right.
thing. It's really nice to see.
Yeah, and 6 years ago, it was definitely a very new concept, and there weren't many other practices out there doing it. Not to say I was the first or anything, but it was mainly concierge medicine that caters to kind of the more elite or financially elite in our communities. And I wanted something for the everyday person, something that the everyday family can afford and that it's manageable for them.
Yeah. And then at some point you got into NAD plus, and I'm going to use the acronym because we were
Yes.
talking about it before, and I'm not even going to try to pronounce it.
Yes, I can try, but it's a difficult word, which is why we go by NAD. But it is a coenzyme in our body that's naturally produced. We do acquire it through foods that we eat and nutrition. But that enzyme naturally declines over time as we age. And so we lose the ability to absorb it through our GI tract. And so that's one of the reasons that level continues to drop. And what they've found through research is that people who have anxiety, depression, ADHD, addiction, that they already have very low levels of that NAD a lot of times. And so then as they age, that just continues to decline. And so that's why, the GI absorption is going down. So the oral supplements that, you'll see advertised everywhere, unfortunately, they just don't tend to work, and they're not very effective. And it's because they just don't get that level up to a therapeutic range. So there's the infusions can get you there more quickly, get you to a therapeutic level. We do have options for switching over to injections to maintain that. And that's different. That protocol is different for everyone. Depends on what we're targeting.
Yeah. It's interesting, so my beginning of my career as far as like a therapist is concerned was an interesting path because most of my supervisors were psychiatrists. And I worked at the Amen clinics for years. They're, kind of on the pop culture side, but, addiction medicines, ADHD medicines, and the gut brain connections were always a super important conversation. And there's been a lot of developments in further understanding that connection. So when we had met and you were talking about it, I was like, well, I've seen this my entire career where, when you work in a treatment center with addictions, you see a lot of those gut brain connections where they don't have healthy diets. They're not getting any proper supplementation,
Right.
But they're loaded up on medications, right? And well, that really works for the insurance companies. And
Yes.
one of the things I was going to state here for you guys following along is, if you've watched any series of our episodes, we bring on therapists, medical providers, nurse practitioners, general practitioners. We've brought on politicians. One of the things you'll see is a pattern that the system doesn't favor the patient. And we pull no punches with those discussions, but we like to have the conversations with people who are trying to make positive change in those directions, because the discussions is really all we can do on our end.
Right.
And it sounds like you've seen the same pattern.
I have, and I just, I want to prevent illness and problems with my patients as much as possible. I'm not an expert in addiction. Let me say that, but I have a lot of patients who deal with addiction, a lot of patients who have anxiety and depression. Either they had that before their addiction, or it's coexisting, or it's a result of the addiction, right? And so I treat a lot of mental health in primary care, but I've always wanted something that's more an alternative, solution that's more natural. And this just seems like a really good fit for that. And, it's all natural. It's like providing a vitamin, a supplement, so to speak. There's very few patients that don't meet the criteria to receive it. But
who should be cautioned away from NAD plus, if anyone?
Right. So someone who has like end stage renal failure, obviously, that's going to be someone that can't handle a lot of fluids, period. They're going to be on limited amount of fluids. Also someone with congestive heart failure, they're not going to process fluid overload. And so they're already on limited fluids they can even take in by mouth. So someone like that is definitely a hard no for NAD. And then if you have an active cancer. So if you have an active cancer, it seems ironic because NAD is very instrumental in repair and healing. However, it also helps the cell, it gives the cells energy to reproduce and to multiply. And so if you've got cancerous cells, then you're potentially feeding those cancerous cells. And so that's the danger there. So those are the people that we would not want to do NAD treatment with, but there leaves room for a lot of other patients.
What if someone comes in, right? And we obviously know in our like professional settings, both medically or mental health, like if someone's actively using substances, because I know we talked about that a little bit in our sit down. Like obviously we would not want someone to come in high or drunk, but
Right.
there are protocols where this could be helpful in the supplementation of recovery efforts.
Absolutely. Because the way it works is in the brain, it affects the neurons and the signaling that goes on in the brain that is very much tied to addiction, right? And so someone who is dealing with addiction they have cravings, and sometimes that can morph into a craving for something else, right? Even if they're on the sobriety journey, right? So what it does is it helps cut the cravings. And what they've shown in studies is that those patients that undergo NAD infusions, and it is a more aggressive protocol with someone like that, that the percentage of patients that relapse during that time is virtually zero. It's very few patients that relapsed when they were receiving the NAD infusions versus someone else that was receiving more, standard traditional treatment during addiction. So it helps with the cravings. It also just helps with repair of the body, because with someone who's been an alcoholic or has abused other substances, they have often done damage to their liver, their kidneys, their brain. We forget about the damage to the brain. And so while I'm not, claiming it can fix everything, repair any damage. The studies have shown that it does repair some of that damage and, helps with the symptoms of withdrawal, especially.
Yeah. I mean, we would dip into the discussion of post-acute withdrawal syndrome, and a lot of people, the best way I can put it just from observation is a lot of people are left to sit with it in modern day treatment centers. This is also kind of a shout out to some of the comments we get. We're like, look at we'll have the discussions on addiction. Like, look at these 12-step cult, blah, blah, blah. I'm a huge proponent of 12-step recovery as an answer. But what I also hope that you see that we've done many times is we bring on medical professionals who also have alternative options. We are not pigeonholed into one way works and other ways don't. We had kind of talked about that last week of like, hey, look, if something else works, rock on.
Right.
Go get it. And we want to expose you guys to that information, because here we have a seasoned professional on the medical side of things breaking down an option that's supplemental to help with recovery. And oh, by the way, I would add, just as a personal note on this, is it will also help with the family members affected by the family disease of addiction, because what often in our society gets forgotten is the levels of stress and cortisol and the issues that arise with being a family member of someone going through active addiction.
Absolutely.
This doesn't make you a crazy person. It doesn't make you physically sick, but it can. And it sounds like these things would help in those arenas as well.
And, like you said, a lot of people that are in addiction treatment centers, or they're going through that process of, withdrawal, they are either told, well, you just got to go through this phase, get through this, or they're medicated with medications that have a lot of side effects. And sometimes those medications that are treating their withdrawal symptoms are actually addicting themselves, which is so ironic. But it's, the truth.
Yeah, we had talked about it a while back on this show where, when Xanax was first breaking onto the scene, the discussion was that it was the off-label cure for alcoholism. And all it did was create another 12-step program.
Yes.
Yeah. It helped a lot of people and does help a lot of people with anxiety, but it also created another addictive process and did nothing for alcoholism.
Right.
Like it just made the disease worse.
Yeah, and it's a short-term fix. That's what I've always told patients over the years, because I have patients that still, they come from that time where that was, standard treatment for anxiety, and they'll request it. But it's, and I will treat my patients, panic disorders, and I'm not going to let them suffer through that for sure. But I don't want to aid in another addictive process, and I know how addicting that medication is, and it's a short-term fix. We need something that's more long-acting, that's going to take care of the underlying anxiety that's going on.
Yeah. This is where we balance each other out as professionals, because I'm always like, bring on the suffering. Let's get a minute and through it,
Right.
But I will never do it without the consultation of the medical providers that I work with, because you can't sit in suffering and stay there forever.
Right.
That is not a good place to sit. And so, we hope that there are more professionals out there like this who are looking for the active ways to do it in a healthy and balanced manner. And it's hard to find, because of some of the things that you've touched on, just on the therapist side of observation. Everybody wants to pump meds.
Yes.
And so when I have like a severely depressed client, they'll come to me having seen 3, 4, 5, 6 different psychiatrists, and I have to refer them, funny enough, over to a nurse practitioner that I've worked with for years to try some natural routes that aren't just like supplements, right? But sometimes often is. But also the nurse practitioners do take the dedicated time, and they often find themselves on the right titrations of medications. And, where before they were just kind of being pushed through the system.
Right. Yeah. And I mean, it's not a cure-all, right? NAD, prescription medications, you have to do the work. And so I do believe, that part of the work is often suffering, right? And they have to go through that to come out on the other side. So they have to be willing to put the work in, not just, do an infusion or take the medication and think that that's going to fix everything. And I've always been a huge proponent of therapy, that absolutely needs to go hand in hand with any other treatment that I provide.
Yeah. If we were to pull this book, The Road Less Traveled, the first line of the book is "Life is suffering," and then you have to turn the page before the real breakdown of that process is explored. And that's another reason why it's my favorite book, is like, we're all going to experience it at some point for some reason or another. We're all going to go through it. And finding ways to navigate that and not sit in it is a lot harder, I think, than people would make it out to be.
Oh, yeah.
I think there's a narrative in our society where awareness and insight are just like this cure-all, right? That everything's going to be peaceful and wonderful.
Right.
And the reality is quite the opposite in ways that you will actually learn to adore in your life, which is that things get harder because you're aware of yourself, and you can no longer behave outright in immoral or hurtful behaviors towards yourself, because now you're aware. And that's a heavy responsibility to carry.
It is. And yeah, I mean, life's hard, and how you meet those challenges head on and how you grow from those things, and grow from the suffering is, very important. I feel like it molds us and shapes us into the people that we become. So I know for me personally, trials and hardships I've been through definitely have shaped me and brought me to where I am now.
Yeah. How would you advocate these things? Let's say, like, in an ideal world, and we can just play with a fun idea here, but if you could kind of have your way on Capitol Hill, what would the discussion look like to get this type of information or the treatment in front of everybody?
Goodness, that's a hard one, because, I just become used to the idea that, these kind of treatments just don't get pushed up to Capitol Hill and, presented. And, we could go into a whole nother, discussion about that, right? But unfortunately, our healthcare system is broken, and it's run by insurance companies. They have the monopoly on and control over our healthcare system, and they have the ear of the politicians a lot of times. So it's
pockets, maybe.
Yes, deep pockets. And so that's, who they're going to listen to. And if it's profitable for them to promote another medication, another drug, then that's the route they're going to go, whether that's the best route or not. And, so many times prevention and, yes, if you have someone dealing with addiction, we can't necessarily prevent the addiction from ever occurring, but can we prevent other medical consequences or other mental health consequences from that addiction and, the sobriety journey? So our focus seems to be in this country not on any of that, on treatment of illness and, injury and the problems after they already exist.
Yeah.
And I just, would like us to have a shift in focus. And I would love to have the ear of, Capitol Hill and the insurance companies to just, even from a financial standpoint, that's what always, drives me crazy, is that I think, okay, if you would approve this treatment, then you may not have to pay for this hospitalization down the road or this more expensive medication because you've prevented other consequences, by approving this medication. And it would be more cost effective. If that's all they're about, then let's talk money. Let's talk what's more cost effective.
Yeah. Cost effective for who? This is where I
Right.
could get real philosophical, and I do these kind of things in my free time for fun, and some of the readings that I do, but it's like we'd be instantly with the insurance companies in a conversation of financial freedom for all or financial freedom for few.
Right.
Screw you. But that's where we're at.
It is. And it's, within my practice, like I said, I don't bill insurance. And so that enables me, if it works for a patient to do telehealth, and they're going to seek out care that way, then by all means, I'm going to do that. Do I need to see them in person sometimes? Yes. But I don't have an insurance company dictating that and telling me, oh no, you can't bill for that telehealth visit. You've got to have them come in the office, whether they can afford to or not, whether they can take off work or not, and that just doesn't make sense to me.
Yeah.
I try to provide care that makes sense.
Yeah. Yeah. Preventative care.
Yes.
Yeah. And it really, fortunately, in an unfortunate circumstance, there are practitioners that are on the preventative side. And just more and more people need to know about it.
Yeah.
Because that, I guess the good news is that isn't going away either. And so there's this tug of war.
There is.
And we may not win on our side, but I don't know if it's about winning or losing, just, as much as it is about educating people that they have options.
Yes.
Yeah.
And because a lot of people don't know they have this option,
Yeah.
or they don't fully understand it. They think, oh, well, I have insurance, so I don't need care like yours because I don't want to pay for both. But they don't see the convenience, that not only the cost savings, but just the individualized care that they can get from someone like me versus someone who has their hands tied behind their back by the insurance company.
Yeah. I don't know how we would even, like, on a large scale, break it down. I was reading this article earlier today. One of the shows I really like and have watched for years and years is The Walking Dead. And I remember it was like season 2. Andrea is one of the characters, and she shoots Daryl in the show, like, grazes him or whatever. And she got like real life death threats. And so I always remind myself that, like, we're dealing a lot of times with the population, although good people, that have a hard time delineating truth, what's real and what's fake, which really does work for a system that is not preventative and really isn't looking out for the patient. And we break a lot of those things down in the world of, like, substance use treatment, having the lived experience of watching people being virtually human trafficked in the name of an insurance policy.
Yeah.
And that absolutely happens on the medical side of things.
All the time.
Yeah.
I see it all the time. And, it is a necessary evil, though, in our healthcare system. And what I mean by that is, you don't want to be caught without at least a catastrophic, policy, so that unfortunately, accidents happen. You get in a car accident, you are injured, and you need surgery. Someone who doesn't have insurance, they're going to get a big hefty bill that they'll be paying on for a long time.
Yeah.
And now it affects your credit. It's just so many things, right? And so often it's a necessary evil, but how do we work or circumvent insurance when we need to, and how do we work with them when we have to advocate for the patient and get what they need. That's always my goal.
Yeah, and this would just be food for thought for those listening along, but it's like, why these huge financial barriers and hoop for the average person when this hospital is a nonprofit that could just forgive your debt for fun and for free? They could do that.
Yeah.
But they won't. And look, like you said, hospitals are a necessary evil. I'm glad they're there. But we have to, as educated professionals, even use that term because that's what it's become.
Yeah.
And it's unfortunate.
Yeah, it is very unfortunate.
Yeah. Yeah. So what do we do?
Right? I mean, I always say, I can't fix the broken system, right, on my own. I just can't. But I can just educate patients that they have options and how this option can work to their advantage and prevent illness. And, we can work together to get what they actually need in the way of care, in the way of healthcare. And I think we're moving, more toward, I'm hearing things, from Capitol Hill about direct primary care specifically, that, primary care is moving in that direction. What that means, I don't know, because, if insurance starts paying for direct primary care, I just don't know what's going to happen there.
Yeah.
But, it's encouraging to at least hear that, people are understanding how the model can work to benefit the patient the most.
Yeah, I think we could probably even look at the mental health field for an answer briefly to that question. It would look different on the medical side of things, but I don't know if it would look too different when you look at things like BetterHelp or some of these big conglomerate therapy practices where it is dominated by specific insurance policies. And sure, they offer to the lay public a cheap alternative, but then, there's more information that's coming out, but I've been paying attention to it as well because I've had my suspicions with BetterHelp for many years that they have an option to text with a therapist that they have not actually been texting with human beings from the beginning, that they've been using automated systems that then became really ramped up with AI. And so, sure, you're getting a very affordable therapy session, but you may not actually be relating to another person. And for some people, they may say like, hey, that's fine. I'm chill with that. And I'm not here to weigh morally on that at all. I'm just saying, like, for a person who thought they were talking to another person for what they were paying through their insurance policy, only to find out that for years you weren't. I think a lot of people would be upset about that.
Yes.
You can't lie to the consumer.
Right.
And I'm not here saying that is 100% what's happening. I'm sure the community violations are coming in on that statement, but I think that would probably happen on the medical side of things too, as ways to streamline to get the money rolling.
Oh, yes. Because, when COVID, kind of peaked, I started my practice right before that. And so I was doing a lot, mostly all telehealth. When the world shut down, I had to provide telehealth as much as possible. And then when everything, started opening back up, other providers were like, how do we do this telehealth thing? I don't know how to do this. Well, I had already been doing it, so it was not a foreign concept for me. Well, now I've noticed that insurance companies are promoting and advertising their telehealth services. Well, I don't know for sure, but I do believe that there are some AI components to that, that when they reach out, who are they really talking to? I do know that, once they do talk to a real person for that telehealth visit, it's just whoever happens to be grabbed for that call. And so what I tell patients is, they don't know you. They don't know your background, your history. You're having to start from square one, all to tell them that you think you have a sinus infection. It seems silly, but I try to just really emphasize with my patients that I want to know them. I want to know their history. I want to know them comprehensively so that I can treat them best. And, in my opinion, telehealth and virtual health is best used in that capacity that, you're dealing with a provider that knows their patient.
Yeah.
But
Yeah. I mean, I hear that all the time where, I'll have to refer a client over to a different medical professional because it's like, well, I see the psychiatrist every 4 weeks and we met for 15 minutes. I'm like, no. I mean, what could they learn about you to slap something on to a prescription pad in 15 minutes?
yeah,
It's not going to
it's
happen.
unbelievable to me.
And then just throw them back over here and like, oh yeah, go work with Alan. It's
Yeah.
like, meanwhile, the growth isn't occurring because the stabilization hasn't occurred.
And a lot of people don't understand that from a psychiatrist standpoint versus a psychologist. I remember going through my clinicals as an NP school, and I was just baffled when I did my clinical rotation with a psychiatrist because it was exactly that. I mean, we sat at a desk and patients were filtered into the office every 10 to 15 minutes. And, at that time, they actually used prescription pads, but they got out the prescription pad, wrote a script, here you go. See you in 4 weeks or see you in however long. And that was it. And I had thought that psychiatrists were also providing therapy and, and real life solutions other than just medications. And they weren't. And there is such a shortage of psychiatrists, especially with children and adolescents. And so I get it. There's a shortage. So they have to see more and more patients to, fulfill that need. But I'm like, where did the rest of the care go? Excuse me. And so I've had to educate patients on that. They'll say, well, I go to a psychiatrist or I need to go to a psychiatrist. And I'll have to educate them on, this is what you're going to get going to a psychiatrist. This is what you're going to get going to a psychologist or a therapist, very different.
Yeah, it really has become a different landscape. I mean, the birth of our field very much was psychiatrists providing psychotherapy with the prescription pads, right, at their disposal. And now it really has become the prescription pad is the session, right? And go talk to your therapist. Which, hey, look, we need the medical professionals and we need the therapists, and we all fill our roles. But there is something that's left to be desired. And I'd worked for a substance use treatment hospital in Southern California. I won't mention their names because, it's one of those big ones that finds themselves in a lot of trouble. And we had a psychiatrist there where I think just as a person, I didn't dislike the guy, but watching him work, it disgusted me, I mean, the way he would talk to patients, and then this is why I very early in my career started aligning with nurse practitioners.
Yeah.
It's like, then you walk into those appointments and they may not have the 50-minute hour, right? But they're taking 30, 40 minutes. They're getting to know their patients, and then, they're not rushing to the next one.
Yeah.
They're figuring out, okay, let me talk to the therapist. Let me talk to the caseworker. I really appreciated those things.
Yeah, it's just more of a comprehensive approach. I never tried to say, oh, well, nurse practitioners are better than physicians or anything like that. And I don't try to set myself at the same level as a physician. It's just we're on a different track. And, we're just taught differently. And our whole basis of our education is based on the patient and focusing on their needs and, just our direct care that we provide patients. And we base that on being a nurse first and then, becoming a provider. So it's just a different way of looking at things. And I've worked with physicians that are amazing and have great bedside manner, so to speak, with their patients. But it's just not something that's focused on in medical school, is how to talk to your patient and how to, get to know them and look at them as an individual and not just as this textbook case that if you meet this criteria, we're going to do this. Right. And, if you fall outside of that, I don't know what we're going to do.
Yeah. I mean, it's even at times like, in the process of teaching young clinicians too, is breaking out of those molds even on our side of the field. It's like, this is not this is a human being, not a cluster of symptoms,
Right.
and oftentimes when someone comes into a session, I always tell the clinicians who work here too, it's like when they come in, you may have a sense in your gut of what's going on, but you may have a real sense after 4, 5, 6, 7 sessions of who this person is and what the issue actually is.
Right.
There are certain things that you want to start to pay attention to and what you're listening for, but that the symptoms that you think you're seeing will morph as you listen to the human.
Absolutely.
There have been times where I'll have somebody come in and it's been told to me by 5 or 6 other professionals, like, that's definitely bipolar. And they come in and it turns out that this person hasn't been honest at all about their recreational substance use.
Yeah.
Right? That has now become a bit of an unmanageable problem. And then they start to get sober and these symptoms that looked like mania go away.
Right.
Right. And it's like, okay, well, that could have been a lot worse if we then put them on, God forbid, lithium or something,
Right.
when they didn't need it.
When we're not addressing the real problem.
Right. Right.
And I mean, even as a nurse practitioner, while I try to center my care on getting to know my patient and building that rapport with them, you're right. I mean, it takes multiple visits sometimes to get all the truth out.
Yeah.
And sometimes I'm blown away by, oh, wow, this has been going on and I didn't know it. And it all makes sense now. It's like putting the puzzle pieces all together. So,
Yeah. We call them, one of the things I've always looked for in my career are the doorknob confessions. It's like right as the session's about to end and the rapport has been slowly building and they're like, oh, by the way,
Yeah.
like, well, I mean, let's start there next
Right.
week, but it's those moments where when you really listen to a human, I always use, because I think in our culture too, people can relate to bipolar a lot. It's a term that gets thrown out a whole lot. When you really listen to a person, you can find out real quick when you're trained what's real bipolar 1
yeah.
or bipolar 2 or not. And it's always baffling because I get a lot. That's kind of one of my
Yeah.
niche areas where I'll get a lot of referrals for it with misdiagnosis.
Yeah.
And there's kind of the standard, like it's either, you'll see like extreme spikes in anxieties, but one of the ones that started to create a pattern of diagnostics for me years ago with bipolar was those who just kind of had a persistent depression, right? That would go away and come back. And then
Right.
the baffling thing for me was like, you'd just seen like 4 or 5 medical professionals and there's a vast difference in presentation between a dysthymic depression that comes and goes and bipolar,
Right.
whether
Yeah.
it's depressive or manic, right? There are distinct differences
Yes.
and it just gets missed.
I could see that for
dangerous.
sure. It is. Yeah. And the substance abuse, mirroring mania and manic symptoms, that could be very easily misdiagnosed.
Yeah.
And, it's the same in the medical field with patients. It's always funny to me, they'll come in for this concern, abdominal pain, but like you said, it's the doorknob confession, it's been, 45 minutes with them. And then I'm walking out the door and like, oh yeah, I've been taking this, supplement, or I've been, eating this new food 5 times a day, it all of a sudden it makes sense. And
Yeah.
I'm like, oh, well, that would have been nice to know that, 45 minutes ago.
Yeah. Oh, by the way, Joe Rogan told me to do DMT. It's like, this would be helpful in the beginning of our assessment.
Right. Exactly. Yeah.
Which is another interesting discussion because Texas has kind of been wrapped up in some of these discussions with psychedelics. I know where I side. What I always share here is like in this setting, I'm very much a journalist. I just want to talk to people. We've had people on the show that are advocates and do clinical trials with psychedelics. In my personal life and in my clinical life, I don't personally align with that perspective, really one iota. Mostly because of the work that I do with people. But I'd be interested to hear your perspective with especially a treatment that you're offering that could very well be a better alternative.
Absolutely. Yeah, I mean, it's just baffling to me when it first came up in the medical community that we're going to use ketamine as a as a treatment for, you know, psychological disorders and mental health issues. And it's funny because, like I said, you know, I wanted to be a veterinarian before I was a nurse. And so I was working in a vet clinic when I was going through nursing school for a very good friend of mine. And we gave ketamine to cats, you know, for surgery. And it was wild to me to watch them in a cage after they'd received this ketamine. I mean, because they were just, it was just wild. I don't even know how to describe it.
I mean, we could just observe people who
Yes.
recreationally use
Yes.
ketamine to get a sense.
And so then when I heard about that we're using this for that, I mean, my mind just went back to that immediately, you know. But I just don't understand it. I don't agree with it. I think there's so many other alternatives. And I kind of go back to, I mean, again, you know, my specialty is not, you know, psychiatry or, you know, I'm not a psychologist, but I do treat a lot of mental health in my practice and primary care that comes up frequently. But when I was, you know, doing my psych rotations actually at a mental state hospital, I was privy to witnessing ECT treatment.
Let's define that for those.
So it's basically shock therapy, to put it bluntly. You know, electrodes are placed on the patient's head, and it induces a seizure, and they're shocking the brain, you know, trying to get it back in line with, I guess, where they think it's supposed to be. And it's used for severe depression, patients who have been suicidal, nothing's worked. So I've seen it used in bipolar patients. And it's just very barbaric. The studies have never really shown evidence that it works.
These are some of the areas that baffle me.
Yeah.
ECT, there's another one too. Like, you know, I think a lot of people would have the image of like One Flew Over the Cuckoo's Nest, where you're chomping down. It's not quite that anymore.
Yeah, they've made it a little nicer
Yeah.
looking.
But and I'm sure you would agree with this as a medical professional, much more of an understanding than even I would have. But it's like what's happening to you internally is no less violent. Your brain is a temperamental system that doesn't need to be tweaked into the right rubrics cube based on another human being's perspective.
Right.
A whole other conversation to
Right.
have there. But
Yeah.
we've got things like transcranial magnetic stimulation, all these kind of things where it's like what's happening to you internally is a lot more violent than what is like happening externally. And we do not. I mean, we don't even have basic understandings of what the mind is,
Right.
you know, but
Yeah.
we're tampering with it in pretty significant
Yeah.
ways.
And so, I mean, and I actually, what's crazy is my grandmother, she dealt with major depression her whole life, and she did not, well, I don't think she did develop an addiction to the medications that she was prescribed for that depression, but she went through ECT treatments. And I did not experience what she was like directly after those treatments, but I know what she was like as a grandmother to me, just very blunted and flat, and you know, there just wasn't much of a relationship and rapport because of she was so sedated. And I do think she developed an addiction to those medications. So I saw that firsthand, you know, and then here we are. I mean, they still do ECT treatments, but the ketamine coming into play just, in my mind, is kind of in that same realm. Like, you know, what are we really doing to this person's brain and body? And we don't even really know. And there could be so much harm that's done. And then do we really have the evidence that it works? Can we really back that up?
Yeah. You know, it's like there's this street drug. It's Trank, right? Which is, I mean, basically it's just like horse tranquilizer, and people are doing it, you know, recreationally, which is as baffling as people using certain types of anabolic steroids and stuff to get performance enhancers. Like, dude, what you're doing to your body is insane.
Right.
But we were talking about a little bit last week, and the conversation is like, why would people do this? And the response was, why not?
Right.
And that's really where we're at with a lot of these things, is like, well, why would the system be pushing this? Why not? They want to see what happens. And if people are going to spend money on it, they're going to spend money on it.
And that's the key, right? I mean, especially if you have someone that feels very desperate, they've been through all these other treatments and they're still dealing with major depression. They are not functioning at full capacity. And so then, they have this treatment waved in front of their face that, this could be it. This could be the thing that, cures you. And so they, they go for it, right? Why not? Why not try it at that point?
This is one where, and I may catch flack for this, and I've had a ton of clinicians on. What's funny is we started talking about it on the show of like, sometimes it got boring where I'd bring on another trauma therapist and, another discussion about EMDR, and they are all wonderful people and wonderful shows and discussions. And we talked about a lot of other things. But it's one reason why, like, okay, EMDR, effective in its own right in different ways. I've never gone to it. And it's for one very specific reason that you were just touching on, is that I don't operate in the realm of cures. Right. I believe that when human beings come in with suffering, it's like a massive iceberg in their life, and we can melt it over time into a manageable spot, but we're always going to be in cold water. Right. And what we learn to do is live in that cold water. Right. That's what we're all doing as human beings. We're never going to escape suffering. There is no cure. And a lot of times in those realms, you start hearing those bents, right?
Yes.
Like, this cured my trauma.
Right.
It's like, okay, well, as long as I've been alive, that's impossible.
Yes.
You don't cure trauma.
It never goes away.
Yeah, you manage
completely.
trauma. The only realms we would deal in cures are the on the medical side of things that we know are curable.
Right.
And we may have advancements on that side, but is it any wonder that that's all in the realm of medical science? There aren't cures in the side of mental science. We don't know.
Right.
Yeah, it's an art more than anything.
It is. And with NAD specifically, I would never make the claim that it's going to cure someone's depression or their addiction. To me, it's a tool. It's an option that, in my mind, there's so many benefits that, the patient could experience from it, and there's very little risk, if any. For most patients, right? And I'm always going to medically clear my patients to make sure they don't have renal disease or something that, they're unaware of that would prohibit them from getting these infusions. But the general public, most people can try them, and it's not going to hurt them to try them.
Well, and I think another reason that adds credence to like the credibility is that you're under more scrutiny as a nurse practitioner to do these things than if a general practitioner or a specialized doctor wanted to break in and do those things.
Right.
And so it's like, I don't imagine, having gotten to know you and getting to know you better, that you would even consider putting your career on the line for something that you thought would cause harm.
No.
And that's what I found with a lot of nurse practitioners, is the attention to detail and care of the things that are actually viable tends to be more scrutinized.
Yes, and that was another reason I started offering the NAD infusions, is because I had patients asking me about them. And I'm not one to jump on a trend or the bandwagon. And so I wanted to really, dive into the research and really understand it from a scientific standpoint. And so once I did that and felt comfortable with the treatment itself, I looked at, where are these people going to get it, And so, not to put down other, facilities or companies, but a lot of these IV drip bars were supplying the NAD for patients. And, there's not a lot of licensed, there's a lot of times there is not a licensed medical professional in the building.
Yeah.
And so, and you don't have someone medically clearing them, so you don't know if that patient that walks off the street has some underlying health condition that they should not be receiving that. Or what are you mixing it with? Are you giving them potassium and they already have a potassium overload, and then you send them into a cardiac arrhythmia? I mean, there are consequences to all IV medications because they go directly into the bloodstream.
Yeah.
And so, I will never put my livelihood and the way I, provide for my family on the line, or risk hurting a patient. That's always my goal, is to protect the patient. So once I determined that, I thought, why would I not provide this? Because I don't want my patients going elsewhere to get it, getting the improper dose, and getting it's mixed with whatever they choose off a menu. I mean, there's a reason that we went to school as long as we did. And so I want to monitor my patient directly myself. And, that cuts down on the number of patients I can see a day. It can be more time consuming, but I want to be the one that personally administers these infusions and monitors the patient. I want them to be super comfortable when they're getting them, so that they want to continue to try it. And because they're not going to reach the full benefit if they just do one infusion, right? You've got to build that level up in the bloodstream and get to a therapeutic level. And that's different for everyone. That's what's hard about NAD. So I have to base it on how my patient's feeling and what they're reporting to me, as to what their protocol should be sometimes. And so I never tell them that, you're going to just be feeling great after one infusion. No, it's going to take some time.
Yeah.
Just like anything, like you start eating, a better diet, or you start exercising. It's not going to happen overnight or within a week. So, I wanted to do it in a safe manner, for my patients.
Yeah, and there's a million things to say about IV drip bars, and those who frequent. There tends to be a certain set of the population after certain activities that gravitate to IV drip bars, and I'm sure many could read through the lines, but when I'm sitting in session and someone comes, I always know it's like my radar goes off when someone says, "What do you think about?" Like when they come with solutions, and that's been one that's often.
Oh yeah.
And the only times I hear it are from those where the discussion on our end has been, you need to get into a meeting, right? And, I shouldn't be getting emails, texts, or calls from your loved one that you were popping off again while you're over here trying to talk to me about an IV drip bar.
Right.
There are bigger fish to fry here.
Yeah.
And so it is nice, again, right, to hear that it's brought under the roof of a medical professional, because it is the Wild West out there a lot of times with these things, which is a bind that I think a free society sits in, is that balance between morality and immorality, which on the side of where we could give grace to, like the side of politics and insurance and money, is a desire to have the greater good. But we've all read books like The Giver, right? And we know what the moralistic ideal turns into, which is kind of a battle against this Wild West, where things should be regulated and are not by the governing bodies that are deciding to regulate certain things and not others.
Right.
Right. It's such a bind.
It is. It is. And, on the topic of FDA, I know that's a hot topic, but NAD falls in this category of medication that it's considered a natural supplement, vitamin, so to speak. It's a coenzyme, really, and peptides, all of those things. They're not FDA approved, and nor are they. I don't feel that they're going to be. I really don't. I mean, you look at vitamin infusions, they've been around for a long time, but FDA has no desire to approve them. And so some practitioners, some providers just don't want to touch it because of that. But, you can go take Tylenol off of the shelf over the counter and do some real harm to your body, if you're taking it in the wrong quantities and doses. And so people, they act oblivious to that a lot of times, and they think, they want to question the safety of it because there's not that stamp of approval from FDA.
Yeah. And it doesn't even have to be FDA, because anybody in our society would agree that the most publicized, most marketed, most pushed substance on the face of the earth is alcohol. And as long as I've been doing this work and working alongside with medical professionals, I have never come across a substance that is more insidious and damaging than alcohol. And you can go anywhere and buy it.
Right. Yeah.
You know, the Bible Belt handles it, I think, a little bit better than some of the other places I've lived in my life, because you can't buy it past certain time frames. But I mean, that's not that doesn't do anything.
Right. Yeah.
People just stock up.
Yeah. They just make sure they get there before it closes. Yeah.
Yeah. But I always think, you know, if we were to distill and make things real, like, easy to understand, alcohol is a good barometer of what is the system going to do. If the masses want it, the system won't fight it.
Yeah.
They will lean into it. And that's just the way of the world. So some of it where we could get maybe up in arms, I take a deep breath, obviously, like you said in the beginning, there's no way we're ever going to change it, but we can have the discussion. And for those who want to join the discussion and do something in a little bit of a healthier manner, that's what we're here for.
Yeah, absolutely. Yeah, they just need to know that it's an option, and it's a viable option for that, you know, has very little to no risk, and it could really benefit, you know, patients. And it is individualized. I mean, and that's what I strive to always do with all my treatments. But, you know, I want to, you know, I'll treat scientifically based on their lab levels and things like that. Like, I'm not going to supplement a vitamin that they don't need. But at the same time, you know, I listen to my patient and how they're feeling, and, you know, how did you feel on that last dose that we did on the infusion? And, you know, just talk to them about frequency. And I'm going to use that together with the scientific, you know, data to decide what that protocol should really be for that patient.
Yeah. If someone's listening along and they're local, where would they find your practice? I know obviously we put the web link in the description, and that'll be shared where we post things, but where would they physically find you? How would you guide them to you?
Yeah, so I'm in Arlington. I would say it's considered North Arlington, right off of 30. Not too far from Cowboys Stadium and Six Flags and all of that. So I'm pretty centrally located. I have patients all over the Metroplex that come to see me, from Dallas to Granbury to Burleson. I mean, it's a pretty central location. And most patients don't mind the drive, you know, if they know that they're going to get the care that they're looking for. So you can find me there at my physical location. And you can also find me online. You can book an appointment with me on my website. We can book a virtual appointment if that's something that you desire, or if you want to see me in person, that's obviously an option as well. So I always tell my patients, I want to do what works best for you. You know, if you can't get away from work long enough to come see me in the office and you need to do a virtual appointment, let's do it. You know, I'd rather that patient access care than not.
Yeah. And you have a team with you over there.
I do.
Who are they? What do they do?
So it's a small team, I will say that. But I have a medical assistant, I have a front desk receptionist, and I have an office manager, practice manager. And they, you know, they know what my philosophy of care is, and that, you know, patient always comes first, and each patient's different. Each patient's needs are different. And I just have a very hands-on approach. I do a lot of things that most providers don't do themselves, you know, like administer infusions and things of that nature, because I just want to have a direct hand in it myself. And when I do refer patients out to a specialist, if that is needed, I like to give a handoff, a personal handoff. I want to give them over to a specialist that I know is going to provide a level of care that, you know, that I agree with. And so I like that personal handoff approach in all areas, like whether they need a psychologist or a therapist. I want to know that I feel confident in sending them to you, you know, for treatment.
Yeah. Yeah, I can respect that.
Yeah, which I do, by the way.
Oh, well, thank you. Yeah, it's nice when you find people that you can trust in the area, because we've all had that experience of you hand off hoping, and then you find out that it missed the mark.
Yes.
You know? And that's always relative, right? I have kind of a split where it's like I'll hand a client off knowing that I'm going to take with a grain of salt the reports that they have of any other professional, because of just the rapport process that was built between us. but yeah, it's nice to have people around that you
Yeah.
can trust.
Yeah, it definitely is.
If we were to handle this next part as like just and you've kind of already thrown in the tidbits, but just a little infomercial on why would they choose April Morris in Arlington, what would you say to those who are listening right now?
I would say, if you're looking for a provider that is going to listen to you, care about you as a whole person comprehensively, and base your treatment plan on what your individual needs are, then you should come to Momentum Health, because that's what I'm about. That's what my focus is. I want to somewhat be a chameleon in the sense that if you are someone who is only holistic and you do not want to take prescription medications, then I'm going to move that direction with you and come up with solutions in that realm. Versus if, you tend to be on the more traditional side, then, I'll try to balance that out and, meet your needs in the way that you see fit as well. Making sure that I'm being clinically safe, obviously. But I want to treat the whole person, and I want my patients to, feel good inside, feel like they look good on the outside as well. So I provide some treatments that, they can make the outside match the inside. And once they start feeling really good, then, it never hurts to build that confidence up. And
Things like Botox.
yes, I do. I do Botox.
No
I do.
judgments.
I do some more natural aesthetic treatments like PRF, which is really cool.
What is PRF?
We draw your blood, and from your blood, we spin it down. There's a process of processing the serum and the whole blood, and we inject that into, excuse me, where you need volume replacement for patients just as they age, or maybe they've lost a lot of weight and they've lost a lot of that volume in their face. I also use biostimulators to stimulate your body to produce its own collagen and elastin. So I really try to be in that natural. I want natural results for my patients. I don't want to put my name on something that's not natural looking. And so I've turned patients away that are seeking more unnatural results. But I feel it's important to give not only women, but men too, just that confidence that they can go out in the world and be who they are and feel good about the way they look, but then also have that match internally.
Yeah. Yeah. Plenty of offerings.
Mm-hmm.
Yeah.
Yeah.
What would you say is your most controversial perspective or opinion within the field that you practice in?
Let me think about that. I would say NAD probably falls within that. And I would just say because people are still learning about it, they don't completely understand it. When I come in contact with other medical providers, let's say a neurologist or a psychiatrist or just other medical providers, and I feel that there is, a need that I could help them with as far as treatment for their patients with NAD, I'm often met with a barrier and kind of a wall that they put up because they just draw that hard line of, well, if it's not FDA approved, I'm not going to put my stamp of approval on it. I don't, they just don't want to really even learn about it sometimes. And so that's where I feel like I can be controversial in that, in their mind that, oh, she's doing these crazy infusions in her office. What is she doing? Yeah. So that's been a barrier that I've been trying to overcome. And I won't be with every specialist that I, encounter, but I hope to get through to some of them and just let them know that it's an option for their patients.
Yeah. Yeah. You could leave the rest to play with ketamine.
Right. Exactly.
Any last comments, statements, things that you want to make sure that we relay while you have this platform today?
Nothing specific, just that, I just want people to know that I'm out there and that it's an option. I may not be what everyone's looking for. I want to just be able to explain, though, how I work, how my model works for my practice, and how it can benefit them, and how I can work within, there's, where they are as far as insurance, no insurance, what is their view on their healthcare, holistic, traditional, that, we can have a discussion about that and build a rapport, and I can get to know you holistically and comprehensively, and find a path that works for you.
Absolutely. Well, as far as we can tell on our end, if you're looking for comprehensive care that actually cares about you as a person, check out April Morris with Momentum Health. All of her information is going to be in the descriptions here on YouTube and in our Facebook videos. We break the cycle here every Thursday, and we will see you guys next week with our co-host, Don Radin. We love you. Take care.